Hello, I'm Nadine Francis. I'm postdoctoral fellow at KU. Our research project is about enhancing calcium crystal discrimination through optimized spectral photon counting CT acquisition. As we know, arthritis is a global health problem associated with various crystals, such as monosodium urate, causing gout, as indicated in the figure, which is one of the most recognized types of arthritis. However, there are other crystal types, such as calcium-based crystals, for instance, hydroxyapatite, octocalcium phosphate, and calcium pyrophosphate dihydrate, and these are linked with a range of joint disorders. So imaging techniques are essential to differentiate these crystals, as treatment depends on the specific calcium variant. However, the current procedures are invasive techniques which involve the synovial fluid aspiration, which is painful and can cause bleeding and infection. So there is a need for non-invasive identification and differentiation of crystals. But the challenge lies in the similarity of attenuation profiles among these calcium crystals. So this study aims to evaluate spectral photon counting CT for calcium crystal identification and quantification and optimize it for improved performance. To give a brief overview on spectral photon counting CT, it's an advanced non-invasive imaging solution that has the potential to diagnose crystal arthropathies due to its higher spatial resolution and the ability to generate multiple images for different energy bins. So our methodology is that to use Mars spectral photon counting CT, which is installed in the medical imaging lab at Khalifa University, and investigate the acquisition protocol for maximum discrimination of calcium crystals. And to do so, we have our study is structured into 3 phases. The first one is to identify the optimized protocol, and this is done by evaluating various scenarios of different tube voltage, different starting energy, and subsequent bin sizes. And further to that, when deciding on the optimal protocol, we will apply it experimentally and theoretically on a various concentration of hydroxyapatite, which is a common type of calcium crystal, which is available in our lab. And then we will derive the correction factor between experimental and theoretical attenuation values to bridge the gap between theory and practice. And in the last phase, we validate these derived corrections through a new scan, or what we call blind scan, consists of randomly placed materials. So our first phase, identification of optimized acquisition. First, to study the impact of tube voltage, we calculated the average and the standard deviation of the total difference of attenuation between all pairs of calcium crystals in various scenarios across 50, 80, 120 kVp. Our results show that there is minimal impact of different tube voltage on the total difference of attenuation. So we logged the 120 kVp to enhance signal-to-noise ratio and optimize photon count rate and reduce detector exposure times. So regarding the starting energy bin and the subsequent bin size, we calculated the difference between calcium crystals across the various starting energy level, each demonstrated by different color, and across different bin size. And we found that the maximum discrimination occurs at a starting energy of 7 to 12 kV and with a bin size of 3. So this concludes to our optimized protocol that will start with E1, 7 to 12, and our second energy bin will be 12 to 15, our third energy bin 15, 18, and 18 to 21, and last one 21 to 120. So further on deciding on the optimal acquisition, we come to the next phase, which is to apply this protocol on a various concentration of on hydroxyapatite. And this is a common type of calcium crystal that is available in our lab. So what we did is we scanned using Mars spectral photon counting CT these various concentration of hydroxyapatite across the 5 optimized energy bins, and we retrieved the experimental attenuation coefficient. And as you can see, there is discrimination among the various concentration of this calcium crystal. So to obtain the theoretical attenuation values, we got it from NIST across the same optimized protocol to compare, to have a ground truth between of our model to bridge the gap between practice and theory. So as you can see, there is discrepancy between the values of experimental attenuation values and theoretical values. So to cover this, we derived the correction factor between experimental and theoretical attenuation values. And this comes to the last phase, which is to test and validate these derived factors. So what we did, we got the experimental attenuation values from a blind scan, which is a totally new scan with a randomly placed material, and we compared it with the second group which is estimated experimental attenuation values. These values were retrieved using derived factors applied to the theoretical LSEs, or attenuation values. So statistical results show that there is no significant difference between these two groups, which confirms the reliability of our derived factors and the effectiveness of our optimized protocol. So our conclusion is that we achieved optimized spectral photon counting CT protocol for better discrimination of different calcium crystals, and we addressed the discrepancies between theory and practice. Our future direction is to employ this optimized protocol to scan other calcium crystals and develop an AI-based deep learning model using these various scans for better identification and quantification of various calcium crystals. And we believe that this will enhance personalized diagnostic and treatment strategies. Thank you.
Thank you, Nadine.